So when you come to the speech therapy session, put on your best teaching suit. And now when I say teaching suit, I'm not talking about physical dress up now, right? But come with a teaching attitude. Pretend that you are a teacher. Pretend that you are a therapist. Welcome back to our channel, and thank you once again for joining us in this another day in the life of living on Autistic Edge. I am Terry Ann Elaine, proud autism mom, and we are here to share with you tips and tricks of how we navigate through our journey right here on Autistic Edge. Today we want to share with you some speech therapy tips for your speech therapy sessions. In order to have a productive speech therapy session, you must have some components to the session. I'm going to be sharing with you 4 components to your speech therapy sessions for it to be effective, constructive, and productive. So, number 1, choose a goal for your speech therapy session. Each time you're having a speech therapy session for your child, make sure you have a goal in mind. All right. And if you don't remember how to write a goal or a SMART objective, you can check out our video right here where we talk about how to set SMART objectives, and that will give you a detailed explanation as to how to go about setting your objectives for your sessions. Number 2, model the words that you are teaching the child. Here are some important things that modeling helps us with. Modeling provides a clear example of what you want the child to do or to say, and it makes it easier for the child to understand. It also engages the child visual and auditory learning. And when I say that, when you are modeling the activity or you're modeling the word, what you find is that the child is seeing you in action, and then he's also hearing what you are saying. So he or she is seeing the words, seeing the movement, seeing the correct pronunciation, seeing the correct position of your lips or your oral motor muscles. And they will also hear what you're actually saying. So the combination of the visual and the auditory will help the child to understand. So another thing that modeling does is it provides reinforcement by encouraging the child to practice. Modeling also provides a sense of motivation, or not a sense of motivation. It does provide motivation. When the child see you doing it, they will want to copy. They too will want to model what you are saying. You are teaching them the pronunciation of the letter M, and you will want to fold your lips. And what that does is it shows the child, it engages the child visual. It shows the child how to place their lips using up their motor muscles, how to place the muscle in the right position. The best position is to sit in front of your child. Whether you're sitting, you're standing, make sure you're in front of your child. And you will notice in most of my videos, when I'm working with Alex Xavier, I am sitting directly in front of Alex Xavier. What you need to do is to ensure that your face is in the right place. Now, when you put your face in the right place, what you do is you encourage focus and you encourage attention. Because when you sit directly in front of the child will be looking directly at you. It's also a good way to encourage eye contact with your child, right? It encourages focus, it encourages attention, and it also encourages eye contact. So remember that. Put your face in the right place. Number 3, repetition. Your speech therapy sessions must always have elements of repetition. Now, if you ever hear the term repetition deepens impression, all right? Now, here is a recommendation. Make sure that you repeat the target word at least 3 times, at least minimum of 3 times. So you can do it depending on your child and depending on how engaged the child is. You can do that as many times as you want, right? But a minimum of 3. If you have a picture and you're trying to teach a child, you're going to say bat, bat, bat. Now, when you model and you repeat what you're modeling, the child will see it. The child will be engaged. The child will be encouraged. And what you're doing really is showing the child how it is done. Repetition allows for practice and reinforcement of the speech sounds. All right. So just bear that in mind. And we did an entire video on the importance of repetition, and we have shared a broader view in terms of repetition and the importance of repetition and why we need to do repetition. So you can check this video out here, the importance of repetition in speech therapy. This is very, very important. All right. And last but not least, feedback. Now, make sure that you are having feedback. Now, feedback can be 2 ways. You can have feedback for your child. And in giving your child feedback, make sure that you are rewarding them, you are praising them, and this encourage and motivate them to want to do more or to say more things. All right. So make sure that you're giving feedback. And now I said feedback is in 2 parts. The second part of feedback, make sure that you are giving yourself feedback as well. Whether you're going to take notes from the session, make sure that as a parent, you review the session that you just had with your child. Take note of your observation, right? Was the word too hard? Was the child getting it? Was the child making any attempt? Because if the child is nonverbal, it's going to be much more difficult. Now, Alex is 13. Alex is now popping out some words. And let me tell you something. The more we model some words with him, the more you just hear him pop out 1 and 2 of them sometime when we least expect it. And they come appropriate. It's not like he's just saying a random word and it doesn't fit anywhere. I mean, previously we probably could get something like that where he was just saying random words and it doesn't make sense. But now his outbursts are very appropriate. So I was asking him a question this week. I don't even remember the question. And I don't remember what is it that I was asking him. And he went like, no. And I'm like, okay then. But the no was appropriate. It's not like it was no because. The no came out and the no was appropriate. I was a little taken aback because even though I'm teaching him and I'm expecting him to respond, that response just shocked me. I thought I would have to prompt him to say no, but yeah, his answer was on point. All right. So just remember these 4 core areas or 4 components or whatever you want to call it of speech therapy. You must have these areas in your speech therapy session. Make sure that you choose a goal or set your goals. Make sure that you model the words, the sentence, the behavior. Make sure that you are doing repetition because repetition deepens impression. All right. And remember to repeat minimum 3 times, no less, minimum of 3 times. And remember, take notes, provide feedback to your child, and provide feedback to yourself. I want to share some other tips with you. Now, while working with your child, be flexible. Pick an activity. But if you pick an activity and the child is really not up for that activity, be flexible. Be willing to change the activity. You may have a goal, but sometimes you just have to follow your child lead. Look at the energy that your child come to the session with and be flexible. All right. Don't make your sessions too long. You don't want the child to be frustrated. You don't want them to find the sessions monotonous and boring. So do not make the speech therapy sessions too long. Even if you practice for 5 minutes per day, 5 minutes, that's a lot. That's a whole lot. You just sit in front of your child and you can model a word, or you pick a word. I mean, we normally have word of the week, whether it word of the week, fruit. Currently, we are working on fruits with Alex Xavier, and we have a fruit of the week. So, every now and again, I'm going to have a conversation with Alex Xavier. What is the fruit of the week? And he's going to tell me. Now, in the beginning, when he did not know how to pronounce the word, I'll say, Alex, what's the fruit of the week? And I will model the word and he will try to say it back to me. But now, when I ask Alex, what is the fruit of the week? He answers me without I even have to model or attempt to model the words. Once you're consistent in doing it every day at different times during the day, that would be enough. It is enough. All right. Now, another tip, talk to your child. Keep talking to your child. We tend to believe that because our children are nonverbal, they might just not understand. And then as a result of that, we don't talk to them. Well, let me tell you something. Me and Alex big fan. Me are the biggest idiot when it comes to Alex. Because all when him not answer me, I talk to him. Okay? So have conversation with them. You never know when one of the words will pop out. Conversations can be around just about anything that you guys working with. Talk with your child, play with your child. This helps to bring out the social skill. Now Alex has now learned a new word, tickle, right? Well, this is something that we have been doing for a while with Alex, right? One of our caregivers actually introduced this tickle thing with Alex Xavier, and now Alex like when you tickle him. He's a little afraid of his side, but he likes when you tickle him, because when you tickle him, it makes him laugh. So he will come and he will hold your hand and he will put it at his side and he will tell you tickle. So you know that you need to tickle him. And we play a little song. There's a little song that one of our caregiver, Auntie Althea, had taught us. Round and round the circle, and she do the finger in his hand middle to it, round and round the circle like a teddy bear. One step, two step, tickle under there. So he likes the little song. So every now and again he will come and just pull you and put your hand and say tickle. So you know that when he tell you to tickle. Now there was a point he would just hold you and put your hand there, or there was a time he will just pull you to him. But now he's telling you tickle, so you know that he wants tickle. So when you keep doing the things over and over, the words will come out. They will come out. All right. Now talk about every activity that you're doing. If you're at the table, talk about the food. Use everyday activities to build conversation with your child. So if it is bedtime, we have a bedtime routine. Alex will say his prayer at bedtime. Now, before bedtime, he knows that the last thing before he goes to bed, he would brush his teeth and he would pee. And then the next thing is we're going to do prayer. And we have our prayer time in which Alex will pray. Now, that helps with articulation and all of that. And after he finished praying, we're going to tell him good night and he's going to respond. We're going to tell him love you and he's going to respond love you too. And you can check out this video as well where we talk about speech therapy using prayer. So that was a good session we have there in encouraging conversation. And we see you and he will tell you tomorrow. And when tomorrow, he says tomorrow, but we know that that is tomorrow. We are working on that word as well. And just before we get out of his room, we ask him, what do you want us to do? And he will tell you, turn off the light and close the door, right? So when you do this, and let me tell you guys, these are just some beautiful moments for us. When we get these kind of moments, you should see us, woo, somersault and everything. Yeah, we are just excited when we get these things. So what we want to do, encourage the conversations, talk about things. So have your bedtime talk, have your bath time talk. Whenever you go to the bathroom, talk about the things that you are doing. So if you're going to brush your teeth, what is this? Toothbrush. What you use the toothbrush to do? Brush your teeth. Talk about it. All right. Alex is brushing the teeth. This is the way, and you can sing little songs when you're doing these activities. This is the way you brush your teeth, brush your teeth, brush your teeth. This is the way you brush your teeth all on a Sunday morning. So have those little time and make your little songs. Use up some tunes that you know, some toddler tunes. Add your own words to it. And I was teaching speech therapy the other day, and if you watch the speech therapy using banana, and I make my own banana song, and of course I really love that song. Banana walk, banana talk, banana make me pick me talk. Yeah, me love the banana song. So make up your own song, build your own activity, build your own vibe, bring your own vibe to the speech therapy session. Snack time, play time, just about any time. You can use those activities as good conversation starter for your speech therapy sessions with your children. Now, observe their interest. Another tip, observe their interest. If your child has a favorite toy or something that they play with, what you can do, use that toy or whatever it is as a teaching moment. Now, I give you an example. For us, Alex, there are a few things that Alex will never leave without. Most of the time you see him, you're going to see him with his tablet under his arm. I'll tell you this, even if Alex is not watching the tablet, he has his tablet under his arm. All right? And the next thing is his plastic bag. You know, the famous Ziploc bag. All right. Now, what we do, we teach him the words tablet and bag. So if he wants the tablet, he will come and say tablet. Now, he's not getting the B as yet, but this is a very great start. All right. This is just an excellent start. So he will come and ask tablet. And if he wants, if the Ziploc bag that he has is damaged, he will come to you and he will say, bag please, bag please. So he's very sure about his bag. So the tablet is tablet, but the bag please, and he knows the correct pronunciation of bag. So if your child has a favorite toy, a favorite blanket, a favorite anything, use that word for that toy, whatever it is. If it's a car, it's a truck, use that as a speech therapy session. So what you can do, you can play along with them with their car. If they love the car, talk about the car. What color is the car? Is this your car? That will teach them yes and no. So there are so many little activities that you can do with having conversation surrounding their favorite item. Another tip is focus on words that are commonly used and easy for them to say. Parents, pay attention to your body language, your attitude, and your tone of voice in your speech therapy session. Children have a way. Children have a way of feeding from our energy. So when you come to the speech therapy session, put on your best teaching suit. And now when I say teaching suit, I'm not talking about physical dress up now, right? But come with a teaching attitude. Pretend that you are a teacher. Pretend that you are a therapist, right? And you're going to make sure that you're giving a good body language. Make sure your body language shows that you're interested in the session, you're interested in them, and that will, capture their attention. Your attitude. Now, there are some parents, they are not the best teachers for their children. I will tell you this. Because some of us as parents, if you think that the child is able to say the word and the child is not saying the word, you're going to get angry. So you're going to talk about like, come on, say the word, you know the word. But and sometimes you might tempted to all want to hit them, because you feel that they know the word, and because they know the word, they need to say the word. But what I want to say to you, remember, this is a teaching session. Remember, it's a therapy session. It's a teaching session. And remember, be patient because it's difficult for them. It's easy for us because we are able to talk. But remember, it's difficult for them. So make sure you come with the right attitude that will engage them. Manage that tone of voice. All right? Always have that teaching, bring about your teaching voice to the session. No, guys, it never easy for me. I had to take off the parent hat because you know what parent does. We give instruction. Come here, take up that, sit down there, so don't move. Yeah, we parents just want to see things done a particular way. But the moment you move away from that, put on the attitude of understanding, put on your attitude of patience, put on your teaching voice. All if you not call the words them properly, all if the English now come out like nice or something, put on something. All right, fake it till you make it. All right, okay. So just put on your best attitude, and guess what? Have fun. Most of all, have fun. If you don't know what the right attitude is, have fun. Once you're having fun, that is going to be a pleasant atmosphere for the child to learn in. They feed off your energy. And if they see that you're having fun, then they too will start having fun. And last tip I'll share with you, always have a sentence to read to your child. Don't read the long stories. I don't read a lot of long stories to Alex Xavier. If you notice our storytelling technique, if you check out some of our Bible story here, our story technique is very different. It's very engaging. And what I do is from our speech therapy sessions, I have at least a one sentence from whatever our objective is for Alex to read that sentence on a daily basis. So if you check out the last video that we put up on the banana speech therapy, you will realize I have that book there, that I have a sentence that Alex will read from this speech therapy session. Make your session engaging, make it fun. Be a clown. Don't be afraid to be a clown for your child. Entertain your child. The sessions must be entertaining and engaging. Remember the 4 core tips now. Choose your goal, model the words, repetition, and feedback. This is where we say, thank you once again for joining us in this another day in the life of living on Autistic Edge. Don't forget to like, comment, share, and subscribe, and make sure you hit that notification bell so the next time we put out another content, you will be notified.